I am reading the scenario. My patient's name is George McDonald, and I am assuming it is today 12 o'clock. I am reading the scenario. It is safe to approach. I am providing privacy with dragging the curtain and performing hand hygiene. 1, 2, 3, 4, 5, 6, 7. Hi George, are you alright? My name is Jean. I'm one of the registered nurses working in this department. Today I am here to do your neurological assessment including vital signs and holistic assessment. Is that okay for you? Yes. So before proceeding further, could you please tell me your full name and date of birth and address? George McDonald, date of birth 1st January 1937, and address is Abigail House, Old Basin, RG 247BN. Okay, thank you for that. So, could you please tell me, do you have any allergies? Yes, I have allergies to latex and pencil. I am so sorry to hear that. So, could you tell me what happened when you had latex, when you have exposure with latex? So, I had rashes. Okay, so could you tell me when you had penicillin before, what happened? So it was anaphylactic reaction that happened at that time. Oh, I'm so sorry to hear that. Okay, anyway, I will make sure that you won't get anything like that during the all my procedure. All right, thank you. So I'll be back with medication, with equipments to do your assessment. Is that okay? All right, thank you. Excuse me. Examiner is the all the BP apparatus and all the equipments for the assessment is calibrated and ready to use. Yes, it is clean and calibrated and ready to use. Okay, thank you. So I can see the BP apparatus here and the thermometer and the pentoscope, pupillary checking, and 4 watch. So I'm going back to the patient side again, performing hand hygiene. 1, 2, 3, 4, 5, 6, 7. Hi George, I'm back with all the equipments I need for the assessment. Are you alright? Yes. So before proceeding further, could you please tell me your full name and date of birth and address, please? Yeah, George McDonald, first January 1937, Abigail House, Old Basin, RG 247BN. All right, thank you. So could you tell me, do you have any allergies? Yes, I have allergic to latex and penicillin. So what happened when you had the exposure of latex before? So I had rashes, and could you tell me what happened when you had penicillin before? So I have anaphylaxis reaction. Oh, I am so sorry to hear that. I will make sure that you won't get anything containing this during my procedure. All right. So thank you. So every details is matching with my patient, and I am happy to proceed. So before proceeding further, are you comfortable? All right. Yeah. So do you have any pain? Yes, I have some pain. So can you please tell me where you have pain? So you have pain in your lower leg. Okay, right leg. Okay. So can you please rate the pain in a pain scale from 0 to 10, where 0 is the least pain and 10 is the worst pain you have ever experienced? Okay, so it is 7. Okay, anyway, Josh, no need to worry. I will document it and I will escalate it to the medical team. And if it is needed, I will discuss with the medical team. And if it is needed, I will give you analgesics. Is that okay? All right, thank you. So, examiner, I am going to proceed with ABCD approach for checking for doing the assessment. So, examiner, I can see that the airway of George is clear and it is free from any obstructions. So, yeah, I am proceeding with the B. All right. So, could you please put your arm on your tummy and please don't move for 1 minute. examiner, I am checking now. Thank you. So, examiner, I got a reading of 30. Mr. George, I got a reading of 30 for your respiration. So, actually, it is a little bit high. Anyway, I will escalate it to the doctor. No need to worry about it. Let me write down in your news chart. So, examiner, George, I forgot to tell you, I have checked your respiratory rate and it is 30 per minute. I'm so sorry, I didn't inform you before. So, examiner, there is no visual signs of any distress and abdominal sounds like wheezing or stridor, and there is no signs of usage of accessory muscles, and there is no CISO respiration. So, I'm happy with that. But the respiratory rate is a little bit high. So I'm going forward to escalate it. All right. So George, I'm going to check your BP. Is that all right? Blood pressure. Okay. So which arm you prefer? Okay, right arm. All right, thank you. So, have you had any surgeries to one of your any one of your arms before? No. All right, thank you. So, examiner, I can see the arm is clear from any infection, any lesions or scars or something like that. So, I am happy to proceed it. I am going to put the cuff 2 to 3 centimeter above the brachial pulse in the right arm. So you will feel a little bit pressure. Are you okay? Alright. So I'm turning on and I go to BP. It is 130/85. I'm happy with the reading. George, I got 130/85. I'm happy with the reading. So examiner, BP is 130/85. Now I am going to check saturation of Mr. George. Is that okay, Mr. George? Sorry, I forgot to remove the cuff and turn off the BP. Yeah, yeah. So it is the saturation probe. Okay. Examiner, I have inspected the finger before putting the saturation probe. It is free from any infection or lesion. Yeah, I got a reading of 98. I'm happy with that. All right, thank you. So I am going to check the pulse rate. So are you okay if you can put your one of your arm on your tummy to check your pulse rate? Yeah. All right. My fob watch. Examiner. I'm starting now. Okay, thank you, George. I have got a reading of 90, examiner. I have got a reading of 90. Yeah, and I am happy with that reading. And rhythm and strength were good. And I forgot to tell you about the saturation. It was 90, 98, and there was no pallor and no cyanosis, and perfusion was good. Sorry about that. I didn't check the perfusion. I'm going to check the perfusion. So, are you happy to give your index finger of your right hand to check the perfusion? All right. Yeah. So, I'm going to just make a pressure over there. So, I'm pressing for 5 seconds. 1, 2, 3, 4, 5, and I'm removing it. 1, 2. All right. So the perfusion is good, and I can see that it is less than 2 seconds. I'm happy with that. All right. So are you okay? Yeah. So do you know where you are? Okay. He knows where he is. So he's in the hospital. And do you have any pain? So you have already told me you have pain over there. Apart from that, do you have any pain other than that? All right, thank you. So he doesn't have any pain other than that. So he is alert, and I am happy with that. So examiner, could you tell me the GRBS rate of Mr. George? Yeah, it is within normal range. Okay, thank you for that. So are you passing urine normally? So that means I want to know if the urine output is normal or not. Okay, yeah, it is normal. So I have seen your medical history and drug history. So you have had myocardial infarction 4 times in the past 5 years, and arterial fibrillation 5 years ago, and you are on medications, donepezil 10 milligram and digoxin 125 microgram, melatonin 3 mg once daily. So apart from these, do you have any relevant drug history or medical history? No. All right, thank you. So I am happy. So now I am going to check your temperature. So I can see the forehead is clear from any excessive sweating, inflammation, and infections. I am happy to proceed. So examiner, I got a reading of 36.7. So I'm going to record it. I'm happy with the measurings, George 36.7. All right. So yeah. So I would like to ask some more questions. Is that okay? So I'm going to check your pupillary reaction. Is that okay? So could you please look out straight, and I am going to check your pupil. Please don't close your eyes. All right, it is reacting. The left side is reacting. I got a 4 really. Right side is also reacting, and it is 4. Yeah. So and I can see the eye movements are within normal range. So and patient is oriented, no confusion present. So can you please make a pressure on my hand for both of the arms? Yeah, one by one. Right hand. Yeah, yeah. So can you please hold my finger tightly? Yeah. So there is no weakness in right arm. Can you please do it on the left arm as well? Please make a pressure. Yeah, push my hand against my arm. All right. Yeah, like that. Yeah. Thank you. Yeah. Can you please hold my finger? Yeah. All right. There is no weakness on the left arm as well. So can you please can I check my your limbs as well? So can you please make a pressure on my hand against my hand? All right. Yeah. Yeah. On your feet as well. Can you please push against my arm? All right. There is no weakness in the right leg. Yeah. Lower leg. And can you please push against my arm with your left leg, lower leg? Okay. Can you please push hard against my arm with your foot? left foot. Right. There is no weakness as well. So, examiner, I am happy with the measurings. So he got GCS of 15, and the monitoring frequency is every 1 hour. So I will make sure that George, we will make sure that you will get the neurological assessment every 1 hour. Is that okay for you? All right, thank you. So I forgot to check your head to foot examination. Sorry, examiner. I'm dragging the curtain again. I'm performing hand hygiene. 1, 3, 4, 5, 6, 7, 8. Sorry. Do you have any kind of abnormalities in your body, like bruise, rashes, any signs of sore, infections, inflammation, anything like that in your body, scars, lesions? All right, no, okay. So I'm happy with that. So I want to ask some more questions. Is that okay for you? So can you walk without any aids? Yes, you can walk. All right. So are you able to go for shopping by yourself? Okay. Yeah. Yeah. So and are you living alone or you are living with someone? Okay, you are living with your wife. Okay, thank you. So do you have any pets at home? Yes. Yeah. So can you please tell me which kind of pets you have? Oh, it is a puppy. All right. Thank you. Yeah. So do you smoke? Yes, 3 to 4 cigarettes per day. Oh, I'm so sorry about that. It is a huge number. So, if you don't mind, I can refer you to the smoking cessation clinic here. Okay, yeah, I will forward it. All right, thank you. So, do you drink? No. All right, thank you. So, are you a religious person? Okay. Do you want to see pastor? No. All right, thank you. So, one more personal questions. Do you have any concerns with your sexual habits? No, thank you. So I have got all the relevant things for the assessment. So anyway, I will escalate about your pain and your GCS score, everything to the doctor. And according to the frequency of the assessment, we will come back to you and we will check it. So examiner, I am going to record. I'm going to check the documentation once again. So I'm checking the full name, George McDonald. Date today, date of birth, first one, 1937. Eye morning, verbal and eye movement. Yeah, EMV. I got 15 total, and I have got respiration 30 and SpO2 98. Blood pressure 135 over 85, 130 or 85, and pulse of 90. Patient is alert, and temperature is 36.7. Monitor frequency 1 hourly. Escalation needed, my initial. So examiner, I am going to replace my articles, and it will be calibrated and it will be clean for the next use. George, are you comfortable now? So do you need any assistance? So here is the call bell. If you need me, please ring. Please call me. So sorry, examiner, I am in a community scenario. I'm so sorry. I won't repeat in the real scenario. So if you need me, please call me. This is your number, and you can call 999 if you need any emergency services. So I'm going to perform my hand hygiene. 2, 3, 5, 6, 7. All right. I'm happy to leave.